Congratulations on choosing to do what you can to improve your health and function. MyMichigan Health is excited to offer this series of exercise videos designed for patients who are living with or beyond cancer. There's strong evidence that exercise or physical activity reduces the risk of many cancers. And for those going through cancer treatments, exercise and physical activity has been shown to improve the effectiveness of the treatments, improve survival rates, and reduce side effects. The benefits of exercising include reducing fatigue, which is the #1 reported side effect of those going through any type of cancer. While it may seem backwards to exercise when you're already fatigued, it's not. Exercise boosts oxygen circulating in your body, which supports energy production and allows your body to function better. It can help reduce pain and decrease inflammation in your body. It helps to maintain your muscle mass, strength, balance, and mobility during the treatments, keeping you as independent as possible. It minimizes your risk of falls and injuries, improves your sleep, reduces the risk of anxiety and depression over the course of your treatment, and improves overall emotional well-being. Exercise and physical activity may reduce the likelihood of long-term side effects of your cancer treatment, such as neuropathy, lymphedema, osteoporosis, and weight gain. It also helps to prevent other chronic diseases such as heart disease and diabetes. Exercise has also been shown to reduce the risk of recurrence in many types of cancers. In general, this will improve the quality of your life, even as your medical team is seeking to improve the quantity of your life. Before starting an exercise routine, please consult your healthcare provider to determine what exercises are right for you. If you engage in this exercise program, you agree that you do so at your own risk, are voluntarily participating in these activities, and assume all risk of injury to yourself. If you have questions about exercising, reach out to your healthcare provider. If you experience shortness of breath, become lightheaded, or any other symptoms of a medical condition, please stop exercising and contact your healthcare provider immediately. No part of this video should be considered medical advice. This video is designed to focus on strength training. The American College of Sports Medicine strongly recommends resistance training, or strength training, for people living with or beyond cancer. This kind of exercise has been shown to reduce cancer-related fatigue, improve overall physical function, and improve health-related quality of life. Strength training can also make your bones stronger. Decreased bone mass, known as osteopenia or osteoporosis, is a common side effect of many cancer treatments. Strength training is also now known to be beneficial for people with or at risk for lymphedema. Not too many years ago, people with lymphedema were told to avoid any lifting or repetitive activity with their swollen or at-risk limb. Now, research has shown that strength training is, in fact, safe and beneficial for these patients. A word of caution: the best rule of thumb with strength training is to start low and progress slow. You don't want to feel the burn. You should avoid aggressive weightlifting that would cause delayed onset muscle soreness. Instead, we encourage you to start low with little to no weights and monitor your body after the workout. If you don't have any significant soreness or any increase in swelling anywhere, then progress slowly. Begin with 1 to 2 pound weights the first week. And while there isn't an upper limit on weight, remember to progress gradually to reduce any side effects. Also, if you're taking a break from exercising and are just getting back to your exercise routine, reduce your weights back by 20 to 50% of where you left off and gradually build back up again. The goal would be to engage in strength training 2 to 3 times per week, making sure you have a day off in between sessions. This video will guide you through safe strength training activities for all major muscle groups of the body. Let's get started.
Welcome. I'm Judy Powers, and we're here to work with you, the breast cancer survivors, for muscle strengthening. Now, not everyone has handheld weights, so if you don't have handheld weights, you can use a soup can. And I'll give that to Paula, who's going to be sharing the lower level of movement. Or Roseanne, you can follow her where she's got a little heavier weights to use. Or you can use a bottle with a lid and fill it with water to the weight that you wanted to use. And Sherry's going to demonstrate how to do the moves in a little more intense fashion. You'll also need a small ball, if you have one available, 6 to 10 inches, just to help you with some of the moves. If you don't have a small ball, I bet everyone has a beautiful pillow at their home that they can use to squeeze or to use in a way that will help with your exercises. So let's get started. And we're going to start with the lower body, move to the upper body, and then end with some core or trunk exercises. Here we go. So we're going to start with the squat. Working the quadriceps, the lower body, the front of the legs. Paula's going to go down and up from her chair, and Roseanne's going to go to the wall or behind her chair, and she's going to squeeze her ball for her inner thighs. Inhale and exhale. Coming up for a count of 2, going down for a count of 2 with a little bit of a pause, keeping the heels down. The hips are behind you and engaging. The gluteals bracing through the pelvic floor. Keeping the knees in a position so they don't jut out in front. And turn your toes a little bit more straight forward and sink back into the heels. And if you want to make it a little bit harder, Sherry could use her handheld weights. She'll do that for the next exercise. How about 2 more? Good. And come up. Last one. All right. Good. Now we're going to do the lunge. So you could also have done this with squeezing a ball between your knees to make it a little more difficult for the inner thigh. All right, let's mini lunge for Paula. Near her chair, standing lunge for Roseanne, and Sherry's going to do a reverse lunge with her handheld weights. In her hands, a bicep curl. So small lunge for Paula. Down and up. Again, right on top, head, shoulders, hips, nice in alignment. And Roseanne's going to go a little bit deeper. So we're going to need to change legs after this set. 4 more. 3, 2, and 1. Bring it back to center and switch to the other leg. Again, watch the knee, make sure it stays at 90 degrees so it doesn't go in front of the toe. Down and up, just a small lunge. And this would be the position you would use if you were going to pick up something on the floor. Good. 4 more. When in doubt, just have them do 4 more. So 10 is about the number that we really need to go to. Stop when you need to. Keep going when you're ready. The next move. Nice job, ladies. You can put the weights down. The next move is going to be a kickback. Kickback to strengthen the gluteals, stabilize the hips, and wonderful for your balance. Sherry's going to do it with her hands behind her head, and she's going to keep this long line. Roseanne is going to do it, leaning on the chair. And Paula's going to do it with her knees bent. Here we go. Kick back. You're going to keep a straight leg. Straight leg, Sherry. Yep. Straight leg. Perfect. Paula's the only one bending her knee. So Paula's just going to go here. Here. Good. 5, 6, 7, 8, 9, keeping your core braced, pelvic floor lifted. And 10, beautiful. And kind of march it out. And Sherry's gonna do this straight leg with the other leg. Roseanne's gonna be near a chair, but her balance is pretty good, so she won't need it too much. And Paula's gonna do the other leg with a hamstring curl and a little bit of a holding. Holding, good. 5, beautiful. 4, 3, 2, and 1. Paula's gonna go to the wall because we're gonna do some push-ups. And Roseanne's gonna push up on the chair. And Sherry's gonna push up on the floor, doing a modified push-up. And now, release and press away. Now, when do you breathe? You're gonna inhale when you come towards the floor, exhale when you create that pressure away. Try and keep your back straight. Brace through your abdominals. Listen to your body if it ever becomes too much. How about just 4 more, or whatever you can do? If you can only do 5 to start and you're following Roseanne, that's perfect. You can rest a little bit and you can do another set in 30 seconds or a minute from now, or maybe next time you could do a few more repetitions. Beautiful. And let's come out of that position, come to a stand, and we're gonna do some rowing. So everyone's gonna stand. We're gonna take one hand with your weights. Paula's going to sit on her chair, and Roseanne is gonna lean on her chair. And we're gonna row from a lunge position. And we're gonna row and down. Yep. So you're gonna put one hand here and row this way. So yeah, that's it. Good. Row and row. Keeping the head and neck in neutral. Working the back of the shoulder girdle, the trapezius, the rhomboid, all those muscles to get them stronger for your balance. How about just 2 or 3 more, ladies? And then we'll switch to the other side. Tuck your chin just a little bit. Beautiful. 3, 2, and switch to the other side. So Roseanne's gonna give you a modified movement, holding onto the chair. Sherry's doing the movement, really working on her balance. That's a major charge for the balance muscles. And Paula's doing it with a can of red beans, which is just about a pound and a half. That's perfect. So at 10, you can finish up. I'm sure all 3 of you have been counting, because I forgot. 3, 2, and 1. Holding on to your light weights. We're gonna do lifted to the side. And we're gonna do a small lunge. And Paula's gonna do it sitting. So that keeps a very, very safe position for her core. Yep, and not too high, Roseanne. Perfect. Right there. This is working the deltoid. Keeping the shoulder blades in your back pocket. Excellent. 4 more. 3, 2. Oh, I can feel those muscles quivering already. Excellent. The next one is a seated biceps curl. Sitting, leaning against the chair if you need to, and standing. So let's go with our other foot in front. So you can bring both arms up and release for 2. Up, 2, and down. 2. Up, 2, down. 2. Inhale and exhale to control it. Up, 2, and down. 2, Excellent, ladies. Up, 2, and as you feel stronger, you can do a second set, or you can do a few more repetitions than just 10. Listen to your body. Pay attention to how you feel and breathe. Is that 10? Excellent. And now we're going to sit on our chair, and let's get a mat for Sherry. We're going to get our ball or a pillow. So Roseanne's going to put her ball in front of her. So this is where the pillow or the ball will help. We're going to work on our pelvic floor. That's the muscle that sits on either side where our vagina and our rectum is, and those are so important and so connected for the bracing and the stabilization of the pelvis. So we're going to inhale, and with the small ball, we're going to squeeze it between our hands. Inhale up, and Sherry's going to go ahead and just squeeze it here and inhale up, or she could lie on her back and do a bridge. You can also squeeze the ball between your knees when you pull up on that pelvic floor. And I usually show this hand position is to think of squeezing that pelvic floor. If it went up to the 5th floor, we want to take it up to maybe the 2nd or 3rd floor. Relax. Inhale and exhale. Beautiful. And just relax here for a moment. You can let your knees drop side to side, Sherry. How we doing back there? Okay? And now we're going to work our transverse abdominis muscle. This is the one that's very, very deep. It goes all the way around to our back. And if you cover your mouth and nose and breathe out forcefully, so put your hand on your belly and cough or huff, huh, huh, huh. You'll feel those muscles deep inside you working. So as you contract the transverse abdominis, the pelvic floor lifts. You can create this bracing action while sitting on the floor. So Sherry's going to lie on her back, and she's going to, with the knees bent, and she's going to lift one leg at a time. Yep. Roseanne is going to lift one leg at a time as she contracts. Paula is going to pull in and brace, breathing out as she contracts. It's almost like you want to feel that bracing action. This is almost like Pilates-based moves. Inhale through your nose, exhale deeply, forcefully through your mouth. And one more. Beautiful. Ladies, I love it. And now we're going to use that pelvic floor work, the transverse abdominis work, and we're going to work our rectus abdominis. So Sherry's going to curl to the side, and she's going to sit up. She's going to roll halfway back with her knees bent. And then she's going to sit up nice and tall. At the same time, Roseanne is going to do this on a chair and lift one leg. Inhale. Paula's going to do it with her pillow behind her back. And press into the chair. So let's do 24,000 more. No, just 8 or 9. You still want to open up the chest and then round the back, but you don't need to come too far forward. This saves us from hurting our neck, lying on the floor to do a crunch, even though that's the most effective, most useful, most familiar way to work your core, but you can do a half roll back in a safer posture. You can still activate those muscles. And now we're gonna do one last move. We're gonna take the ball or the pillow. We're gonna put it in our hands. We're gonna slide our shoulder blades in our back pocket. We're gonna work the obliques, the ones that turn us side to side, and our rectus abdominis, and our transverse and our pelvic floor. So take a big breath in and rotate to one side. Inhale up, rotate to the other side. Exhale, rotate gently, listening to your body. You can do it from a seated posture. Just make sure the chair doesn't have wheels. You're gonna lean back ever so gently. We've got about 4 more. Again, counting for yourself and deciding, maybe writing it down so you can remember. They say, research says the most effective diets are the ones that we record what we eat. And why wouldn't that be effective? To record what we do for our exercises. And that can help us to stay accountable. Excellent job, ladies. Let's come to a seated position. I'm gonna have you, Sherry, sit right here. We'll do a final stretch. Take the right arm up and lean to the side. Inhale and exhale. Let's lean to the other side. We've just worked our muscles. We got them stronger. There might be a little bit of soreness the next day, but probably not. We'd like to add to this by doing your muscle strengthening every other day. And you can add the activities. Doesn't matter who you are, you can still do this. Take your arms behind you, open the chest, hold on to the chair if you'd like. Feel that biceps, the chest, and those muscles in the front of your torso stretch out. And now bring your hands across the body, one elbow below the other, and give yourself a nice big hug to stretch the posterior side of the body, the traps. You can round your back a little bit, looking down. And let's turn to our right. And bend that right knee and bring the left leg back like we did from our stretches. And feel that stretch for our hip flexor. Maybe a little bit of your quadriceps. And now turn to the left on your chair and bend the knee. Take it back and feel that stretch for the hip flexor, the quadriceps, the front of the leg. Beautiful. And the last stretch we're gonna do is for the hamstrings. So take that right leg out to the front. The toe is up and you can lean forward and just hold it there. Big breath in, let it out. Again, keeping the back in neutral to protect the low back. And then sit back up. Let's switch legs. Ladies, I can't thank you enough for your time, your energy, and your muscle conditioning, your strength training skills. Let's take a big breath up. And thank you so much for joining us today. I hope you'll come back often and participate in our strength training video. Thank you.